Medication, possibly surgery. They're the new recommendations by the American Academy of Pediatrics for children struggling with obesity.
Well, the new guidelines published this week are the first comprehensive changes to the Academy's obesity treatment guidelines in 15 years, outlining treatment options for children as young as 2. Weight loss surgery for a 13-year-old. It may seem extreme, but it's part of a new set of recommendations from the American Academy of Pediatrics. For the first time in 15 years, doctors are urged to take a more prominent role in the growing obesity epidemic.
Our efforts at identifying at-risk children and then trying to intervene with really lifestyle changes, more guidance, more emphasis on diet, nutrition, physical activities, working with schools, that none of those things have really worked, and that we're still seeing those same rates of obesity that, if anything, are increasing.
It's an eye-opener for most parents. 15 million children in the United States on a scale with weight are considered obese, sometimes carrying that burden into their adult life. But it's not just the weight physicians are concerned about. Young children are being diagnosed with adult diseases, specifically an increase in type 2 diabetes.
The thing that we really worry about, particularly with type 2 diabetes, is the long-term complications, things like kidney problems, eye problems. You hear about people having circulation problems where they lose a limb or they go blind or end up on, dialysis or something. Those can happen 10 years after a diagnosis of diabetes. So if we're diagnosing someone at 12, now we're talking about someone potentially in their 20s that's having really significant medical problems.
So no more waiting for the adult doctor when a child turns 18. Pediatricians will now consider prescribing weight loss medications at age 12 and suggest bariatric surgery to a very small percentage of patients by 13 to shrink the stomach and limit the amount of food a person can comfortably consume.
It's not as simple as saying if you just ate healthy and you moved around more, you wouldn't struggle with this. And that's what's become really obvious in pediatrics. And so what we've learned is that it really is a chronic disease, and it's very multifactorial.
Well, the pandemic fed destructive behaviors of inactivity and unhealthy eating, so parents should focus on a healthy future for themselves as well and their children, in addition to exploring these treatment options.